Good morning.
Good morning. Good morning.
It's good to be with you this morning. I hope that our time together is very meaningful and productive, and that you can take some information away that you can use for some very important life decisions. And I also like to say, when I'm in large gatherings, aren't you glad that I'm not seeing you in my professional capacity this morning?
Yeah.
All right. Very good. Very good. Well, many of you know I have served at the hospital for a long time. I've gone on year 21 almost, and in that context I've had experiences in the hospital, in CCU, with hospice, when people have made a decision to go to comfort measures and enjoy life as much as they can at home, and then in the extreme geriatric setting with the nursing home. So I have met with literally hundreds of individuals and families over the years who have one thing in common, and that is when they come to making decisions for themselves or for a loved one, it is a monumental struggle. It's difficult at best to have some of these conversations. And so this morning I'm just going to give a brief introduction into that conversation that all of us need to have at some time or another, first and foremost for ourselves. What's important for us as we grow older, as we encounter chronic illness, as we encounter terminal illness, and the decisions it's important for us to make, and the decisions it's important for us to communicate to those who are going to be our primary caregiver, our power of attorney, and so forth. So, first of all, when we start to talk about end of life, how many people like to have that conversation? Okay, we're in the minority, I see. Most of us like to talk about living, not dying, because that's a very difficult conversation to have. And there's a lot of reasons for that. First of all, for many of us to talk about the reality of our approaching close of life, whenever that is, whether it's 5 years away, months away, or 30 years away, for a lot of people that's just a morbid subject. We don't like to talk about that because that brings lots of emotions to the table that we don't want to have. So that often cuts off the conversation. But for a lot of us, I think it goes back all the way to how our parents handled the subject. And again, each of us had a parent, a mother or a father or both, and how they modeled talking about their own end of life, or how you saw them talk with your grandparent about end of life, probably set the template or the model for you. If it wasn't talked about, if it was kept hush-hush, if we just kind of pushed that under the rug, then more often than not, we are likely to have done the same thing. Our parents and our grandparents, when it comes to talking about end-of-life issues, more often than not, set the model for us. Parents or previous generations just didn't talk about those kind of things. For some of us, it's all about our personality. All of us have different personalities in this room. Some of us talk openly about anything and everything. Some of us are very private individuals who would never think about beginning that conversation because, again, it probably traces back to the model of your parents or grandparents and how they talked about things or did not talk about things. What makes a conversation difficult to have is, for some of us, illness, because that's bringing it right up front. A lot of us, and it's been my experience with a lot of patients, they know what's going on with their body better than anyone else. I've had patients tell me when they come in and taken their bed rest in the hospital, I told the doctor this is what's going on. And the doctor said, oh no, that's not really what's going on. 4 or 5 days later we do the dance and they come back around and the patient was right in terms of what they understood going on with their body. So when you begin to experience chronic illness and that goes on for a number of years, some of us have a very clear understanding that things are changing that's probably leading us to the end of life in the coming weeks, months, or in the year ahead. For a lot of people, that conversation is not prioritized. It's not important because Someone else can make that decision. My child can make that decision for me. My husband or my wife can make that decision for me. And yet, when I am with that individual in CCU and I ask, what did your loved one tell you was important as they're on the vent or as we're trying to determine what other treatment we want to do, they'll say, well, we never talked about it. We never talked about it. They always thought that somebody else could make that decision for them. When I come to families that have multiple children, you can almost be sure that if there are 3 children, there's probably at least 2 different opinions, if not 3 different opinions, on what we should do for mom or dad. And those people who are farther away and maybe not observing what's gone on with mom or dad over the last several months, they're working through their own issues because now they want to be the savior or the rescuer and do everything that's possible for mom and dad, while the person who's been there has seen that mom and dad's been on this road for a long time. And the person that's here probably has a better sense of what mom and dad wanted than the person whose job, whose career, whose life has taken them away from the situation. So, different opinions with children. We don't want to talk about it because that's going to make somebody cry. Well, the reality is, end of life is sad. And when we truly care about somebody, we're going to have some emotions about that situation. And I tell people the more we care, the more it's going to hurt. But when we make that focus quality of life, then we're doing everything in our power to make whatever time left they have remaining the best possible. Finally, talking about it makes it real versus some future unscheduled event. You know, if we start the conversation, which is the title of our seminar today, that means we're probably going to get into some deep water. And for some of us, we're going to talk about an issue that we've never talked before about with anybody in our life. And so it's going to bring it to the forefront very quickly. Now, what makes the conversation not only difficult to have, but even harder to have? 3 different things here. First of all, end of life. It's hard to have a conversation with your spouse about end of life when they're on a ventilator. That conversation is not going to take place. 99% of the time that person's sedated. They're not going to be able, first of all, to talk, and second of all, even if they're awake, writing out their wishes is going to be difficult at best. It's going to be hard to communicate what's important for the patient when they can no longer be able to respond as clearly and as personally as they want. What makes the conversation harder is waiting till the funeral. And in this context, we're talking about the role that Matt and Wendy play in doing arrangements. You can have just as many opinions at planning the funeral as you can when somebody is trying to determine whether we're going to do comfort measures or do aggressive measures to keep them alive. Families have a lot of conflict, not only at the bedside in CCU, they have a lot of conflict when they go to plan the funeral. So again, the need for that conversation. And this extends even to when the funeral is over and we go to the final will and testimony. Well, Mama told me that was going to be mine. Or Daddy told me that I was going to inherit the tractor. Well, it's nowhere in writing because nobody ever had the conversation to say, Dad, let's put this all in writing so we can minimize the conflict and the arguments and the difference of opinion when that comes down the road later. It all begins with how we're going to start that conversation. So what makes the conversation happen? First of all, it's honesty about the reality of life. The minute that you and I are born or the minute that you and I start dying. We start that countdown. So as we get older, it's important for us to start talking with our spouse, start talking with our children. What is important for me? What's important if I get into a car accident and I go on life support? What's going to happen? What's going to be important if my heart stops beating or I stop breathing? Do I even want to be put on life support? What makes the conversation happen besides honesty is mutual concern. Both the parent and the children, or the husband and the wife, truly want to do what is best for their family member, and they want to know what is most important for their loved one. Okay? So when you look across the kitchen table at your spouse, or when your kids come to visit, can you ask that question, Mom or Dad, if X, Y, or Z happens, what is most important for you? What do you want done? What do you not want done? What is your definition of quality of life? Because it's easier to have that conversation before somebody is put on life-saving machines than it is afterwards. Because the reality is, the older you are, being put on a ventilator, the less chance that you are going to have that taken off without dying. Okay? The odds of a person being taken off a ventilator and living, the older they are, drop very quickly. So it's much better to have that conversation beforehand and be able to begin to process those emotions and those circumstances than saying, yes, we're going to put Mom or Dad on a ventilator, and then 6, 7, 8 days later have to make the decision to pull them off. So one of the things I encourage people to do is have this conversation with your doctor about your living will or your advance directive, so you can have a professional answer the questions that are important to you about your specific health needs, because each of us have different and unique bodies, and so the decisions going into that will be unique for you. What makes the conversation happen, thirdly, is a willingness to listen. Somebody has to talk and somebody has to listen. And so beginning that conversation with a simple question opens that door, but everybody has to be willing to say, whatever Mom says, I'm willing to listen and to talk about. Because it's really not your call how somebody else needs to bring their life to a close. And I hope that all of us understand how important that is. Only I can really determine what's important for my quality of life at the end of life. Nobody else is going to be living in this body. So it's important that I express myself and make it very clear to my spouse or to my children, to my grandchildren, whoever that influential caregiver is, that this is what I want and I need your help with the doctor to carry that out for quality of life at the end of life. I think another thing, and some of you here have had this experience happen, when you have witnessed this for yourself, with another family member, it brings the issue right up on front stage. Both of my in-laws, my father-in-law went through hospice care. He was taken off a ventilator and we expected him to live about 24 hours at best, and he ended up going into hospice and living 10 days. My mother-in-law, who died a year ago at the end of August, was on hospice almost 2 years because she had presumed breast cancer and a heart condition that would not allow them to operate. So her choice was, if we can't do anything about the cancer, then we just ride this out. And that allowed her to be pretty much on her own in assisted living until the last few days of life. So I've seen a couple different scenarios there myself of how important it was for families to have the conversation, for the patient to express to their family what was important to them, and then to put that into action. And then when it comes to potential legal decisions, everybody needs to have a conversation with their loved one about who's going to be a potential power of attorney. If you are not coherent enough to make decisions for yourself, who are you going to entrust with that? That's, again, part of this conversation. And then, if you want to try to minimize the tension and the issues that come up with planning the funeral, Matt and Wendy have great information today to help you prearrange a lot of those decisions.